What causes tonsillitis? Tonsillitis is the inflammation of the tonsils, two oval-shaped pads of tissue at the back of the throat. It is most commonly caused by viral infections, such as adenovirus, influenza virus, or Epstein-Barr virus. In some cases, it is caused by bacterial infections, particularly group A streptococcus, which is also responsible for strep throat. The condition is more common in children, but it can occur at any age. Tonsils act as a first line of defense against pathogens entering through the mouth or nose, which makes them prone to infection. The inflammation can be acute, sudden onset, recurrent, or chronic, lasting or recurring over time. Exposure to airborne droplets from an infected person can spread the infection easily, especially in schools or crowded areas. Inadequate hygiene and close contact with infected individuals increase the risk of transmission. Tonsillitis symptoms? Common symptoms include a sore throat and difficulty swallowing. The tonsils often appear red and swollen, sometimes with white or yellow patches or coating. Other symptoms include fever, bad breath, and swollen lymph nodes in the neck. People may also experience headaches, ear pain, loss of appetite, and fatigue. In children, tonsillitis might cause abdominal pain, nausea, or vomiting. Voice changes or muffled speech can occur due to the swollen tonsils. In severe cases, breathing difficulties or snoring may result from enlarged tonsils blocking the airway. Chronic tonsillitis can lead to persistent bad breath, sore throats, and frequent infections. Treatments for tonsillitis? The treatment depends on whether the cause is viral or bacterial. For viral tonsillitis, treatment is mostly supportive: rest, fluids, throat lozenges, and pain relievers like acetaminophen or ibuprofen. Antibiotics are used only for bacterial tonsillitis, especially when caused by streptococcus bacteria. It is important to complete the full course of antibiotics to prevent complications like rheumatic fever. In cases of recurrent or chronic tonsillitis, doctors may recommend a tonsillectomy, surgical removal of the tonsils. Saltwater gargles and warm liquids, like tea with honey, may help relieve symptoms. Steroids may be prescribed in severe cases to reduce swelling and pain. Bacterial infections involved? The most common bacterial cause is group A streptococcus, Streptococcus pyogenes. Other less common bacterial culprits include Mycoplasma pneumoniae, Neisseria gonorrhea, and Corynebacterium diphtheriae. Bacterial tonsillitis often presents with a sudden high fever, intense sore throat, and white patches on the tonsils. It may also cause scarlet fever, a red rash, if caused by streptococcus. A throat swab is often used to diagnose bacterial tonsillitis and confirm if antibiotics are needed. Prompt treatment of bacterial tonsillitis is essential to prevent complications such as peritonsillar abscess, rheumatic heart disease, or post-streptococcal glomerulonephritis. How to avoid tonsillitis and take precautions. Good hygiene practices are key to preventing tonsillitis. Wash hands regularly, especially after coughing, sneezing, or touching shared surfaces. Avoid sharing food, drinks, or utensils with others, particularly if someone is sick. Keep your immune system strong through proper nutrition, hydration, sleep, and exercise. Avoid close contact with individuals showing symptoms of respiratory infections. In crowded environments like schools, teach children about covering their mouths when sneezing or coughing. Disinfect commonly touched objects like doorknobs, phones, and keyboards frequently. If you or your child frequently suffer from tonsillitis, consult a doctor about possible underlying conditions or the need for tonsillectomy. Vaccinations like the flu shot may reduce the risk of viral infections that lead to tonsillitis. Please don't forget to subscribe and hit bell icon.